Okay. All right. Hi, Dr. Islam here. Okay, so I'm going to be talking about some Botox for the platysmal bands of the neck. Okay. So very typically, some patients get like very ropey bands, and we can actually inject Botox along these lines here, and actually even along the jawline, and that's called a Nefertiti lift. But even along the platysmal bands, and that'll actually help soften up those bands. So when people strain, you see these big, long, ropey bands, and that'll actually help soften it up, and then actually lift the jawline up on the patient. Another area as well, you're seeing a couple of dots. I'm just going to go over it. These are the DAOs. So if a patient has like little corners of the mouth, it's drooping a little bit, we can, if you see here, we can address these muscles over here and in these corners, and actually that'll help actually raise up the corners of the mouth a little bit on those sides. Sometimes some patients will kind of see how much Botox will do. They might still need some filler, but in her case, she's actually a perfect candidate for that. And actually in her mentalis as well. So if you can do me a favor, yeah, there we go. You see this muscle here? We can actually address this, and you can actually see it throughout the DAOs over here. And you can kind of see we can address this with actually some Botox here as well, and that'll help soften up any like orange peel skin on the chin there. So we'll take care of her, and usually 3 to 7 days to start kicking in Botox, and 10 to 14 days for full effects. If any touch-ups, 2 weeks from now, we kind of take care of her and fine-tune anything. All right? Take care, Dr. Islam.